Welcome back to Market Headline. Following mounting public pressure to impose tougher measures, the government has finally announced the tightening of COVID-19 restrictions to prevent the collapse of the country's healthcare system amidst the recent surge of COVID-19.
Following mounting public pressure to impose tougher measures, the government has finally announced the tightening of COVID-19 restrictions to prevent the collapse of the country's healthcare system amid the recent cash surge. Coordinating Economic Minister Erlangga Hartarto announced the tightening of the micro-scale public activity restrictions, or PPKM Micro. The tightened restrictions stack Efek for 2 weeks until July 5. Public health experts say widespread travel during the Muslim Eid holiday period and the circulation of the more transmissible Delta variant are believed to be driving the latest surge. The increase is putting pressure on hospitals, including in Jakarta, where 80% of hospital beds are full, and has added urgency to the government's plan to inoculate 1 million people each day by next month. Authorities have so far only fully vaccinated 12.3 million of Indonesia's 270 million people and partially immunized another 10.9 million. Previously, the World Health Organization said Indonesia's drastic increase in hospital bed occupancy rates was a major concern and necessitated stricter public health and social measures, including large-scale social restrictions. IDX Channel reports.
The positive cases of COVID-19 continues to increase. To deal with this, and government has finally firmly chosen to implement micro PPKM. How is the PPKM implementation so far? Let's examine it further in the next graphic. So here it is through your screen. We can see on how government implement the PPKM micro. Here it is. The office in the red zone have to apply work from home by 75% and work from office by 25%. How about the essential sector? The activities can operate up to 100%, and dine in at the restaurant maximum of 25% of the capacity, and learning activities in the red zone are carried out to online. And there is a news data regarding about micro regulations of PPKM that President Joko Widodo is about to lead internal meeting now to discuss details of planned new measure called emergency PPKM, so we will see in the further notice. And before choosing PPKM micro, pressure emerged from the public where the government was asked to carry out stricter restrictive measures such as lockdown. However, through an official statement, President Joko Widodo stated that the government has chosen micro PPKM through various considerations. In addition, President Joko Widodo ensures that micro PPKM and lockdown have the same essence. At the same time, the government also stated that micro PPKM will not kill the community's economy. Is that correct? Is there any differences between the implementations of PPKM micro and lockdown from economic point of view? Let's check it out in the next graphic. So here it is. We can see the measure between lockdown and non-lockdown. First of all, if the scenario was lockdown, the funding needs around 11 up to 25 trillion rupiah for 14 days, and the risk of losing GDP range for 77 up to 308 trillion rupiah. And 2021 economic growth is predicted at 3% up to 4.5%. But if we don't do non-lockdown, the risk of losing GDP range from 463 up to 848 trillion rupiah, and 2021 economic growth is predicted at 0.5% up to 2%. And various parties doubt that the government courage to take stricter restrictive policies such as lockdown, given the impact that it will be very significant for the economy. And not only that, the implementations of lockdown will also force the state to meet the needs of the community in accordance with the law. And this is something that the state feels has not been able to fulfill given the limited budget. So with the high spike of COVID-19 cases from day to day, there are things that the government has not done optimally, one of which is testing. To know more clearly, let's check it out in the next graphic. Here it is. We can see COVID-19 testing rate. In your screen, we can see that Indonesia, from the total cases of 2,225,000, the testing per 1 million populations is only 70,700. But if we compare it into Singapore, which is the total cases is pretty much less than Indonesia, within 62,544 cases, testing per 1 million populations reached almost 2.3 million. It means that we can see that Indonesia is lag behind Singapore, Philippines, and Malaysia within the total cases that is surging right now. And the level of testing in Indonesia is still quite low, even when compared to the Southeast Asian countries. Not only testing, Indonesia's vaccinations rate is also still slow, where only about 13 million Indonesians, or 4.8% of the populations, have been fully vaccinated. And regarding to this, Indonesia must continue to increase its vaccinations rate, and this has also been stated by President Joko Widodo, who targets around vaccinate 1 million people per day in July and 2 million people in August. In addition to testing and tracing, treatment is also one that must be optimized, especially with the increase in the hospital bed occupancy rate. How's the data? Let's see it in the next graphic. Here it is, viewers. Through your screen, we can see the number in hospitals bed occupancy rate. To the graphic, we can see that the national bed occupancy rate hit 67%, while the isolation's bed occupancy rate in Jakarta only reaching 92%, and around 92,240 total beds prepared for the COVID-19 patients, and ICU occupancy rate in Jakarta reaching 87%. And the Ministry of Health even revealed that currently in a number of areas, the occupancy rate of hospital beds has also increased even more than 80%. Where in Yogyakarta and Central Java, it reached around 85%, Banten by 87%, West Java by 88%, and this is certainly an obstacle for COVID-19 patients who must receive a treatment. Meanwhile, from the Whole World Organization say that Indonesia's drastic increase in hospital bed occupancy rates was a major concern and necessity stricter public health and social measures, including large-scale social restrictions. And yes, viewers, hopefully the government and all levels of society can work hand in hand in dealing with this surge in COVID-19 cases, and hopefully the pandemic will end soon. Stay tuned. Market Headlines will be right back after this quick break.